Good evening to each and everyone. We are the Group 3 and we are assigned to report Lesson 2 entitled The Sexual Self. So here's the learning outcomes. At the end of this topic, students will be able to discuss and elaborate concepts associated with the sexual self. Identify elements that give to one's sexual development and explain how one can manifest responsible sexual behavior. Your sexuality includes all of your feelings, thoughts, wants, and behaviors toward other individuals. You might find other people to be physically, sexually, or emotionally alluring, and these shades are a part of your sexuality. So, sexuality is a broad area of study related to an individual's identity, sex, expression, sexual orientation, and gender identity. So, it is the capacity to have erotic responses and experiences. So to make it more specific, sexuality is diverse, and there are many different types of it. And it takes time to figure out the sexuality that fits you best. Kasi your sexuality can change over time. That is why sexuality is an important part of who you are. Kasi there's no right or wrong naman eh. It's just about what's right for you. So it's truly exciting and liberating, and of course, positive experience to discover your sexuality. So now let's proceed with sex. So sex describes the physiological differences between the bodies of men and women, as well as the other intersex bodies. And these will be further discussed by my co-reporter, including biological sex, which is determined by a physical characteristic and is assigned at birth. And of course, puberty, which is the time when young boys and girls go through the process of sexual development.
The human sexual behavior. So sex, like food, is an essential component of our life, and the apparent persistence of the species is the rational from an evolutionary standpoint. And human sexual activity is much more than reproduction, because this may include the erotic or sexual thoughts and experience of a person. And it also relates to the person's sexual interests and attraction to others. And sexuality is distinct or different from biological sex because it relates to the sexual desire and feelings of a person. And on the other hand, the biological sex describe how one's anatomy, physiology, hormones, and genetics are categorized. So typically male, female, or intersex. And also, gender identity is a perception of gender and social cultural categorization. Like you're gonna be categorized like man, woman, or another gender. Based on biological sex, also we can distinct it from sexuality because it differs from influences, sexual orientation, or emotional and sexual attraction to a specific sex or gender. And thoughts, dreams, wants, belief, attitudes, values, action, practices, roles, and relationships are examples of how sexuality may be experienced and expressed. And this takes biological, physical, and emotional forms and social cultural forms that deal with the impact of human society and culture on one's sexuality. And some experts believe that sexual behavior is primarily influenced by hereditary. So we basically inherit it in our ancestor or our parents, and while others feel that the environment largely shapes it, because they believe that we are gradually influenced by our environment, which may affect our sexual behavior. And also human sexuality is influenced by cultural, political, legal, and philosophical elements of life, and also morality, ethics, theology, spirituality, and religion. The human sexual response. So, the human sexual response cycle is the physical and emotional changes that occur when a person is sexually aroused and engaged in sexually stimulating activities like sex or masturbation. And understanding how your body reacts during each phase of the cycle is very important, because this might help you improve your relationship and pinpoint the source of any sexual issues that you experience in your life. And there are 4 stages to the sexual response cycle, which are the excitation, plateau, climax, and resolution. And these stages affect both men and women. However, the timing is generally different. It's usually, for example, that both lovers would have an orgasm at the same time. And the strength of the response and the time spent in each phase differs from one individual to the next. And understanding this distinction may help couples and better understanding one another's bodies and responses, which can help them to improve their sexual experience. So the first phase of sexual response is excitement. And the following are some of the features of the excitement phase, which can last anywhere from a few minutes to many hours. And in the excitement phase, we can feel that our muscle tenseness rises, and the breathing and the heart rate quickens. And it's possible that your skin will be flushed, or we can see the blotches of redness appear on the chest or in the back, and the nipples stiffen or become erect. And increased blood flow to the genitals causes enlargement of the woman clitoris and labia minora, or inner lips, and erection of the man penis. And the lubrication of the vaginal canal commences, and the woman breasts enlarge and her vaginal walls become larger. And lastly, the man testicles enlarge and his scrotum tightens, and a lubricating substance is excreted. So the second phase of the sexual response is the plateau. And the plateau phase, which lasts until the onset of orgasm, includes the following general characteristics. So in the plateau phase, a woman or a man can feel the first phase of modification are accelerated, and the vaginal walls turn a dark purple as the vagina continues to expand due to the increase of blood flow. And the clitoris of the woman becomes extremely sensitive. Perhaps it is painful to touch, and it retracts behind the clitoral hood to prevent direct stimulation from the penis. And the testicle of the male tighten, and your heart rate and blood pressure are all rising, and muscle spasms can start anywhere, including the face, feet, and hands. And lastly, the muscle tenseness rises. And the third phase of sexual response is called the orgasm, which is also the climax of the sexual response cycle, and it is the shortest of the stages, which is lasting only a few seconds on average. And the following are some of the general features of this phase, which are the muscle contraction that are not voluntarily begin, with a fast oxygen intake, blood pressure, pulse rate, and respiration are at their maximum levels, and muscle spasms in the feet happens, and sexual tension is released abruptly and forcefully, and the vaginal muscles contract in women, and the uterus also has regular contraction, and the rhythmic contraction of the muscle cause ejaculation of semen at the base of the penis in men happen, and a rash or sex flush may develop all over the body. And lastly, the fourth phase of sexual response is called the resolution, which the body gradually recovers to its average level of functioning after doing stimulating activities like sexual intercourse or masturbation, which swell throughout resolution, and erect body parts restore to its former size and color. So after a person indulge in stimulating activities, the body gradually or naturally goes back to its former size, color, and this stage is characterized by general sense of well-being, increased closeness, and in many cases, exhaustion with more sexual stimulation. And some women can quickly return to climax phase and have several orgasm, and on the other hand, man requires a refractory period or a break following orgasm during which they are unable to achieve orgasm again. And the length of the refractory period varies amongst men and typically grows longer as they get older.
So, sexual dysfunction can manifest itself at any point in the sexual response cycle. So, basically, sexual dysfunction can be any problems that prevent a person or couple from experiencing satisfaction and pleasure from sexual activity. So, hindi nila mararanasan or ma-achieve ang 4 classic stages of the sexual response cycles, which includes excitement, plateau, climax, and resolution. And according to research, some of 43% of women and 31% of men reported some degree of sexual dysfunction. So, sexual dysfunction is really the main reason why a sort of people ay hindi nagkakaanak dahil siguro baog sila, hindi enough ang kanilang cells or gina-reproduce, and nawawalan sila ng gana or nawawalan sila ng interest sa sex depending upon their certain issues. So let's move to the 4 types of sexual dysfunction. Number 1 is the sexual desire or interest disorders. Ito ang lack of sexual desire or interest. Totally na mawawalan talaga sila ng gana when it comes sex. Maybe they experience psychological and physical abuse to their partner that causes them trauma. Like, ginapilit sila mag-sex kahit hindi nila gusto, kaya it leads na nawawalan sila ng interest. And maybe as they've realized, mas prefer na nila ang mag-self-love instead of staying sa abusive sex life. Number 2 is the arousal disorders. The inability to become physically aroused or excited during sexual activity. Ito naman ay hindi sila physically, mentally, and emotionally excited when it comes sex. Like, there's no excitement intended here, but depending upon their certain issues. Let's just say na si Juan ay nakipag-sexual interaction sa babae, but na-recognize niya na hindi pala siya naka-feel ng excitement and pleasure dun. And he is eager talaga to answer why hindi siya sexually active sa babae. So si Juan, nag-try siya magipag-sex sa same gender niya, which is lalaki. And dun, na-realize niya na mas prefer niya makipag-sexual interact or intercourse sa lalaki, at dun niya na-feel ang 4 stages of sexual response, and yes, naging sexually active siya sa lalaki. So, sexual excitement will depend or result to your own preference. Number 3 is the orgasm disorders, the delay or absence of orgasms. Ito naman ay hindi talaga siya magahusan or mawet man lang, and according to research, organismic dysfunction is that a woman either cannot reach orgasm or trouble reaching when she is sexually excited. And lastly, number 4 is the pain disorders, the discomfort during sexual activity. Ito naman ang pain during intercourse. Like, yung habang sexual intercourse or interact kayo, na-notice mo na mas lamang ang sakit kesa sa satisfaction and pleasure. Ito yung resulta sa ginapush ni lalaki si Junjun na ipasok kahit hindi pa enough soften or smoothen sa flow ng kanilang intercourse. That's why dumudugo mostly ang vagina ng mga babae.
So, in males, the inability to establish or maintain a sufficient erection or hard penis for intercourse in males. Ito yung difficulty to maintain an erection or a hard penis. So, erectile dysfunction is a very common condition, particularly in older men. It is estimated that half of men between the ages of 40 and 70 will have it some degree rather. So, number two is the ejaculation is absent or delayed despite adequate sexual excitement. So, what causes of delayed ejaculation? Ito ang resulta sa substance misuse or a mental health concern such as depression, anxiety, or stress. It is also due to a combination of physical and psychological concern. And lastly, the inability to control ejaculation timing. The main symptom of premature ejaculation is not being able to delay ejaculation for more than 3 minutes after penetration. In females, the inability to have orgasms, it is also called anorgasmia, which means the difficulty of having an orgasm after plenty of sexual stimulation. Resulta ito sa stress, past sexual experience sa partner, and how you feel about your sexual activity. The vaginal lubrication is insufficient before and during intercourse. So, vaginal dryness happens when the tissues in your vagina are dry, thin, and not well moisturized. Ito yung example ko kanina na dumudugo dahil pinipilit ni lalaki na i-push kahit hindi pa enough ang smoothness nito. And lastly, the inability to relax vaginal muscles to the point where intercourse is possible. And what causes sexual dysfunction? Number one is the physical causes. Like, yung totally tired ka na physically and wala ka ng time to intercourse or interact. That's why nawawalan ka na ng interest dito. And number two is the work-related stress and anxiety. Concerns about sexual performance like yung nag-aisip ka nga maganda ba performance mo or hindi ba siya satisfied, and it leads na mag-overthink ka na talaga. Marriage or relationship issues, depression, feelings of guilt like yung habang sexual intercourse kayo, nag-think ka na gusto mo ba talaga ito or not, and you felt guilty by yourself. And concern about body image, like yung mga flaws natin. But remember guys na maganda ang ating flaws and imperfection. So we should learn to love and accept it. And the consequences of prior sexual trauma are all psychological reasons.
Hello everyone, my name is Merky Singito and now I will report about the sexually transmitted disease. Through sexual contact, sexually transmitted disease (STDs) or sexually transmitted infections (STIs) are spread from one person to another. Vaginal, oral, and anal sex are the most common forms of contact. However, they can occasionally spread by another close physical touch. STD is the bacteria, virus, parasites that may, as I've said, it may pass from person to person in blood, semen, or vaginal and other bodily fluids. This is because some STDs such as herpes and HPV are transferred through skin-to-skin contact. But sometimes these infections can be transmitted non-sexually, such as from mothers to their infants during pregnancy or childbirth. The following symptoms: painful or frequent urination, strange discharge from the penis or vaginal area, source of or warts on the genital area in the genital region, itching and redness, sores or blisters around the mouth, disturbing vaginal odor, itching, discomfort or bleeding in the anal region, pain in the abdomen, and also fever. So the next is, how are sexually transmitted disease (STDs) detected? So some STDs actually don't any cause symptoms. It possible to contact sexually transmitted infections from people who seem perfectly healthy and may not even know that they have an infection. So how to detect it? So if you are sexually active, you should talk to your health care provider about your risk for STDs and whether you need to be tested. So about that, uh, it is important, really important, to consult to the doctor because STD do not usually cause symptoms. Some STDs may be diagnosed during physical or microscopic examination, uh, like fluid swab from the vaginal or penis or anus. Blood tests can diagnose of STDs. So the next is, what are the suggested treatments for sexually transmitted disease, STD? So the treatment that they prefer, the antibiotics. So one of the treatment antibiotics, but uh, the STDs actually known have a cure from, but through antibiotics, it will help to lower the risk of spreading the infection. So the next is the correct usage of latex condoms. So even though you use it correctly, but it will also threaten you to have STD disease. But the most consistent to prevent it is that not to have any anal or vaginal or oral sex. So there are also available vaccines to prevent HPV and hepatitis B. So the next is, everyone must make responsible decisions regarding sexually and sexual behavior. One's could remind of the following insights. So the following insights are self-respect from one's own body. So the self-respect from one's own body, it entails taking care of one's body and refrain from engaging in behavior that make one's valued. So the next is the maturity of thinking and action. So it means being objective, responsible, reasonable, and claim rather than getting carried away from one's emotion. So the next is the following one's particular ideas and ideals, having ideas. So it it says that everyone, especially adolescents, should be guided by their values and sense of self-worth. Is the or lastly, having a forward thinking attitude. So a person should continually consider the potential implication of their current activities in the future. So we need to think before we do that kind of action to prevent the problems.
Natural and artificial methods of contraception. When you say contraception, it is the deliberate use of artificial methods or other techniques to prevent pregnancy as a consequence of social intercourse. So there are three types of contraception, and the first type is natural methods. When you say natural methods, it is a natural family planning methods, do not include introducing any chemicals or foreign bodies into the human body. People who are extremely mindful of their religious views are more likely to utilize natural birth control methods. Some people choose natural techniques since they are less expensive. So the first type of natural method is abstinence. When you say abstinence, this natural method entails refraining from sexual contact and is the most effective natural birth control method with an ideally 0% fail ratio. So, abstinence is simply not having sexual intercourse. It means kamo both sa imong partner nag-decide na dili mag-sex, including vaginal, oral, and anal sex. Because after all, the sperm is dili maka-fertilize og egg if walay sexual intercourse. And abstinence kay naga-prevent og pregnancy by not giving the opportunity for semen to enter the vagina. So the second type of natural method is the calendar method, also called the rhythm method. This natural method of family planning includes ceasing sexual contact when the female is fertile. Calendar method helps the couple to predict the fertile days by tracking the length of the female's menstrual cycles over several months. Next is the basal body temperature or BBT. It can be used as a way to predict fertility by helping you gauge the best days to have or avoid unprotected sex. The woman must take her temperature every morning before any activity is done. If she notices a slight movement, decreasing and then increasing in her temperature, thus this is a sign that she has ovulated. The woman must abstain from sexual contact for the next 3 days. Then, the coitus interruptus. The couple still proceeds with the coitus or sexual intercourse, but the man withdraws when he ejaculates to the scent of spermatozoa outside the female organ. Coitus interruptus, or most commonly known as withdrawal or pull-out method, in which a man during sex kay i-withdraw or tanggalon niya iyahang penis from woman's vagina paghapit na siya magawsan to avoid insemination. Then the last part of natural method is the hormonal injections. The injection prevents ovulation and causes variations in the endometrium and the cervical mucus parts. Hormonal injection, it is contraceptive injection to prevent pregnancy by injecting a synthetic version of the hormone progestogen called dipomedroxyprogesterone acetate or DMPA, or commonly known as DIPO. So the second type of contraceptive methods is the artificial method. It refers to a variety of methods used also to plan or prevent pregnancy but are not dependent on woman's fertile days. The first type of artificial methods is the oral contraceptive. It includes synthetic estrogen and progesterone, sometimes known as the pill. So there are three different types of oral contraceptive pills. The first is combination pill, the second is progestin only pill, the last is continuous used pill that can be bought in the pharmacy without prescription. The second is intrauterine device or IUD. An IUD is a tiny T-shaped device placed into the uterus via the vaginal canal to prevent conception by generating a local sterile inflammatory state that inhibits implantation. The third artificial methods is chemical barriers such as spermicides, vaginal gels, and creams. Glycerin films are also used to kill sperm before they reach the cervix and reduce the pH level of the vagina to make it unsuitable for sperm. Chemical barriers can be bought in the pharmacy without medical examination or prescription from the doctor. Then the male condoms. It is an artificial rubber casing put on the erect penis before vaginal penetration to catch the sperm when ejaculating. Male condoms can also avoid sexually transmitted illness or STI that can be bought over the counter without prescription. And male condoms must be removed to be disposed of after sexual interaction. And the last type of artificial method is the female condoms. These are also latex rubber coverings that are specially created for females and pre-lubricated with spermicide. Female condoms is worn inside the vagina and it prevents pregnancy by stopping sperm cell to meet the egg cell. The last contraception methods is the surgical methods. Surgical birth control is one of the most effective techniques of birth control. There are only two types of surgical methods, and the first type is vasectomy. Males get vasectomy surgery, which involves a tiny incision on either side of the scrotum. Vasectomy is a minor operation that stops men being able to get a woman pregnant. The tubes that carry sperm from a man's testicles to the penis are cut, blocked, or tied. And the second and last type of surgical methods is the tubal ligation. When you say tubal ligation, it is a technique that involves occluding the fallopian tubes in women by cutting, cauterizing, or blocking them to prevent sperm and ova from passing through. Tubal ligation prevents an egg from traveling from the ovaries through the fallopian tubes and blocks sperm from traveling up the fallopian tubes to the egg cell. 2 to 3 days after this procedure, the lady can resume her sexual activity. That would be all, and thank you for listening.
That would be all, and thank you for listening.